Hello, and welcome to Mind and Medicine. This is where two doctors from two different scopes discuss topics centered around mental health and physical wellness. I'm Dr. Bernadette Smith,
And I'm Dr. Okojie.
and we wanted to start our topic today with advocacy. Before we got started, I wanted to share a little bit about what our roles are in our respective fields. And so I am a licensed professional counselor and the owner of Aspen Counseling and Wellness, which is a group counseling practice based in Texas. And we provide mental health services to anybody in Texas because, again, that's the beautiful thing about telemental health. Dr. Okojie, tell us a little bit about what you do.
I'm a naturopathic physician. I have licensure in the states of Arizona, Washington, and Oregon. Our specialty is hormone replacement therapy and anti-aging medicine. And that encompasses quite a bit, but we deal with men and women who are dealing with aging, andropause, menopause. We have weight loss programs. We have intravenous nutritional therapy or IV therapy. So any and all things that have to do with kind of preventative medicine, aging gracefully, and managing hormones. That's our expertise. And we're out of Oregon, Washington, and Arizona.
Okay. And we've been friends for a long time and colleagues for a long time. And oftentimes when we're consulting, we find that kind of that mental health and that medicine piece that you have really intersects. And so that was one of the reasons why we decided we wanted to start to kind of share our knowledge base with others, because it really is a balance. Like I look at counseling from like the wellness wheel, right? And if one thing is out of order, then it's going to impact the other one. And so one of the things that we also talk about a lot is advocacy. And that's why we wanted to start our first session with advocacy, just to talk about why we feel it's important and how we can help empower the people whom we work with, our listeners, to advocate for their physical and mental health.
Yeah, absolutely. I think, when dealing with a practitioner, oftentimes patients, whether they be coming in for medical assistance or for counseling, there's a power imbalance that's just inherent with that. Because if I'm coming to someone for help, either medically or mentally, like I'm looking for this practitioner to help me out. So I think oftentimes patients and clients feel, a little bit disempowered to be able to speak up for themselves. And I think we're doing a good job making this our first kind of episode, because the power of your health is actually with you. And as a physician and yourself as a counselor, we're just there to assist and guide. And so the more that patients and clients know and understand that their health is really in their hands, then the easier it makes our job. And I think the overall wellness of the patient increases.
Absolutely. I tell my clients every time, you're the expert of yourself, and
Right.
I'm here to guide you along this journey.
Absolutely.
So we were talking before, and you had shared that you kind of have a first experience with advocacy in your younger years. If you wanted to share with the listeners as well.
Sure. I can remember when I was about 7 or 8 years old, I got in a car accident with my dad, and his head crashed into the front windshield. And he went into the ER, and they stitched him up, and I was waiting for him outside. And when he came out, he still had dried blood on his forehead from the crash. And as a 7-year-old, in my mind, I was like, wow, they couldn't wipe the blood off of his head. He just been in a life-threatening accident. And I remember asking him, Dad, how come they didn't wipe the blood off your head? And he was just like, son, don't worry about it. And that really stuck with me. And it made me think, wow, we have to speak up for ourselves. That seemed like common sense, basic medical care to me. And it wasn't done. So at that point, I became a big advocate for myself and a big advocate for patients, speaking up for themselves and getting their needs met.
It's interesting hearing you say like that was the turning point for you to advocate for yourself, because when we met in college, you were already advocating for yourself at such, kind of a young age in those college years. So it would be interesting to see what young Dr. O was looking like advocating for himself as a 7 or 8 year old, because my daughter is 7. It would be interesting to see like, what would that actually look like? But yeah, absolutely. I think for me, it makes me think about just different times where I felt uncertain because, this person comes in, and they were typically older than me, right? And they would come in and they would say, this is the thing, and not quite knowing or understanding maybe what they might have been referring to, or feeling as if, okay, maybe they're missing something. And so for me, that's why I like to empower my clients to be like, hey, let me know if I'm off base. Like, I'm human, right? Like, yes, the field of counseling is my field, but I can make mistakes, and yourself, and just being able to give them that power, I think is so, so important.
For sure.
So I know that advocacy can look different depending upon the field of care. I know for counseling, like I said, one of the things that we have informed consent documents for our clients so that they're aware of kind of the limitations of counseling. They're aware of confidentiality. They're aware of all of this stuff before they actually go in to that first session. And then I also, before we start our first session, I kind of give them that spiel about, hey, you're the expert of yourself. This is, let me know if I'm wrong. Let me know if I'm off base. Tell me if I misunderstood or suggested something that isn't applicable. Like, I give them that whole spiel up front. But I'll periodically, I'll do check-ins through our sessions, like, am I off base? Am I right? Am I wrong? Right? Like, constantly giving them that opportunity to advocate for self. But I cannot think of a time where I had that same type of information shared to me from a medical perspective. So what does advocacy look like on that medical side?
Yeah, it's a good point, because in the two different fields, like in the field of counseling or therapy, you're gleaning a lot of information from the patient's personal experience and how they interpret things and their issues and their traumas, etc. A lot of times in medicine, patients are coming to us looking for, a pill or something directly to either treat a particular condition, whether it be acute or chronic. So I think they come in expecting to give less input. We draw their blood and, we get images or whatever, and they're like, okay, fix it. Rather than sitting down and having a conversation about their feelings or past traumas. So, our fields kind of diverge in that way. But regardless of that, I've spoken to so many patients who've gone to their primary care provider, gone to the ER, and they'll leave with questions. And I'll ask, hey, what does this mean? Or did you ask them that? And they'll just be like, well, no, I didn't ask. Or they just told me this. Or I'll ask them, what's this medication for? And they'll have no idea. They'll just say, hey, the doctor told me to do X, Y, Z. And I think it's important to kind of break down that stigma of a doctor, because oftentimes medical doctors are held at such high regard. They have all this knowledge that we don't have. And people feel afraid to ask questions. They don't want to question the doctor. So I think what that looks like, to answer your question, is just listening to yourself and speaking up. It's your body. You're paying for it. You're paying for the insurance, or you're paying out of pocket directly. And it's incumbent upon the physician to get your questions answered. And I know it's difficult to talk to your doctor directly with insurance, and you may have to go through your nurses or the admin, but they're providing a service for you that you're paying for. So when you have those questions, just feel free to ask them. And it's okay, because I know oftentimes people feel like, well, I don't want them to think I'm that patient who asks a lot of questions. Well, they're going to think that anyway. Trust me. We have those conversations about people anyway. So if we're doing that, then you might as well get your questions answered. I think it just literally comes down to, if you have a question and you don't know something, then ask it.
Yeah. I love what you said, because it makes me think about when I'm working with my clients, and I'm like, okay, it really is just delivery. Right. And so it's not like the majority of my clients who I work with them on, them feeling more comfortable expressing kind of their needs and stuff like that. I'm like, hey, you're not going to come off as rude or disrespectful, because that's not who you are innately. And so then I wonder if maybe part of that feeling more comfortable asking those questions is just being mindful of, okay, how are you asking? Right. So you're not like, well, what kind of medicine is this? Right. But like, oh, hey, Dr. O, I see prescribed me this. Like, what is this for?
Yeah.
Are there any concerns that I need to be aware of? Right. And I guess that's the other thing, right? If the doctor is unable to answer that, then we should probably question,
Right.
is that the doctor that we want?
Right. It's interesting too, because it just makes me think. Oftentimes people are going to a doctor wanting something. They're wanting a prescription, they're wanting a drug, they're wanting a treatment. So I can understand the hesitancy in coming off as being rude, because then there's a fear that the doctor won't give me this medication. So I understand why people might feel a certain type of way about that. But again, if that's the energy that you're getting from your physician, if possible, I would say move to a different physician. Because if you feel like asking a doctor a bunch of questions, it's not going to get you the proper treatment or the treatment that you think you want, and you can't have a conversation about that, then that's a doctor-patient relationship that needs to be adjusted or severed, to be honest.
Okay.
Yeah.
I think we kind of already covered it, but we've been talking about like how to advocate for yourself. And so essentially what I'm hearing both of us say is speak up.
Right.
Ask
Have you had any of your clients or patients come to you and say, I did my research on you, and like, that's how I found you?
Yeah.
Yeah, I get that a lot too. I always ask them like how they find me. Oh, I did research. And so that's another way to advocate as well, because sometimes you'll know just by doing a Google search and reading Google reviews if that's the doctor for you or if that's the counselor for you. So that's another tool that clients and patients can have in their tool belt. You have the internet at your disposal. We all have websites and Facebook pages and Instagram pages. So if you're interested in seeing a particular practitioner, look them up and read the reviews. That way you kind of know, you can have a brief idea about their personality or the way that they work. And that way it helps you to make a better determination of whether or not you want to work with them.
So here is where our fields differ, right? So in the medical field, right, there is, you can ask your clients to give you Google reviews. And there is, is it WebMD or wherever where you can like rate, there's tons of places where you can rate your doctors.
Yeah.
But in our counseling codes, it is unethical for us to ask a client to review us. And so there are tons of discussions held in my counseling communities that talk about ethical ways in which we can receive reviews. But the thing is, if somebody's looking for reviews, they may not be able to come across them. Because again, we're not asking people to review because we can't necessarily do it. Because there's such a power dynamic, right? And so it's like after somebody wipes their tears and you're like, oh, hey, write me a review, right? Like it's a power dynamic. However, one of the things that we do in my practice, Aspen Counseling and Wellness, is we offer free consultations. And there are a lot of counselors that do offer free consultations. And I feel like that is a great way to advocate, because what occurs is, and I've done it myself, right? I've done consultations with counselors whom I was looking for my own personal life.
Right.
And what it does is it gives you an opportunity to kind of get a sense and a feel for that clinician. Because with my field, I feel that your ability to reach those therapeutic goals can really make a difference depending upon the counsel that you have.
Right.
And so through that consultation, it gives that person the opportunity to ask whatever questions they have of the counselor, ask about their insurance, ask about, their approach to therapy, so on and so forth. But then on the other end, it gives the counselor, right? It gives our team the opportunity to say, okay, the concerns that you're bringing, is that within my scope? Can I actually take you on? Or do I need to refer you to somebody else in the group or somebody outside of the group? And so that's the way that somebody would advocate for themselves in the counseling world when you cannot necessarily count on reviews.
Count on a review. That makes sense. Yeah, we do the same thing at our practice as well. We offer free consultations. I mean, we're kind of a specialty practice. And so there's questions about that. So we do offer that free consultation. It's, you know, I can empathize with patients because a lot of times their access to a practitioner is guided by their insurance. So they may not have access to the best physician or counselor that's for them, which makes it more of an issue or more important for them to advocate for themselves because now their lane is limited. So it's even more important, it's even more incumbent upon the patient, I think, to really find and seek that practitioner that works best for them.
Yeah. And educating about what that looks like if they do use somebody who's out of network. Mm-hmm. Because in the counseling field, and I imagine it's also the case in the medical field, if just because somebody's not in network doesn't necessarily mean that you can't submit your super bill to the insurance company and get some type of reimbursement. Now, it's not going to be 100%, but at least it can be some part of a reimbursement. And that's where you advocate for yourself with the insurance companies. I think about, as I'm saying that, I think about my son, and he was a slow talker. Like he was not wanting to talk. And I was like, okay, he is like a year and he's not even saying no, like there's something going on. And no is one of the first things that kids pick up. They're like loud and no and no. And so I wanted to start speech therapy with them, but his pediatrician was like, oh, he'll be okay. Let's give it some time. But my mommy radar was like, no, let's try to start this process sooner. So I ended up calling my insurance company to find out about how does the insurance cover speech therapy and when do they, give the green light, like at what age do they allow for speech therapy? Well, come to find out, because I think at this point he might have been like 13, 14 months or something like that. Come to find out, they didn't have age minimum, right? An age requirement. And I didn't need a doctor's referral. So I started the process on my own without my doctor's, stamp of approval, because I called the insurance company. I asked the questions that I needed to ask so that I can find out, okay, how do I get him this care that I felt that he needed at the time?
Sure. Yeah. I mean, that's a big piece, just the basic knowledge of, insurance can be quite tricky and it can be really cumbersome. So sometimes people just need to take some time out and understand what their insurance actually covers.
Yeah.
And in my case, we don't accept insurance directly, but like you said, there's options for super bills and there's HSA and FSA accounts. So another thing is that people should advocate for themselves with regard to their benefits. And then some of these services and practices that they think they may not be able to get because they don't have insurance or because they only have insurance, there might be a workaround. So that's a really good point.
Yeah. As we kind of wrap up the advocacy topic for today, is there anything that you want to kind of leave with our listeners?
The biggest thing. Yeah, I think what I would say is, kind of the theme of this particular episode is you're your own boss. No one can advocate better for you than you. So prioritizing what your needs and goals are and understand that health is holistic. So someone might say, oh, do I need hormone replacement therapy? Do I need to do this? Do I need to do that? And you might not have a good idea about how big of a priority that is to you if you're not speaking to a counselor. So these things kind of go hand in hand. Sometimes people think they need a pill to make themselves feel better. No, actually they need to, heal some past traumas. Some people think, oh, I just need to heal this past trauma. No, actually they might need a pill. They might need some pharmaceuticals. So I would say to patients, to listeners, to people seeking medical advice or counseling advice, like explore all avenues and realize that you ultimately are making the decision on your on your health. And then we're just here to guide.
Yep. I love it. Looking at the whole person and not just a portion of it.
Right.
All right.
Yep.
I love it. I mean, you said it best.
Yeah.
So I hope that everybody listening found this content valuable, and we encourage you to like and subscribe and share with others. But we also value the questions and insights from you all. And we encourage you to send us any questions or topics that you would like for us to incorporate into our next episode, as we would love to get that feedback. So until next time, thank you and have a great rest of your day.
Bye.